Okay, hi everybody, this is Dr. Parve. Today we're going to talk about care of the international traveler. And back in the day, people just went to the travel clinic and we didn't have to deal with this, but now you'll find out more and more people are traveling and more people are coming to their primary care provider to get their shots and to get information on what they need when they travel. So in the future, that could be one of your jobs. And I know I just talked to a DMP student that works in an occupational health setting, and she has to do a lot of travel medicine. Okay, let me just figure out why my screen's not changing. Come on. Okay, for some reason my screen is frozen, so let me just try it here and see if that's a little bit better for us. I'm not sure why it's freezing. Okay, well, let's try this again. So what I'm going to do is I'm going to get out of this screen, get out of this, go back and try again. Excuse me. So let's try this again. Okay, well, there we go. I don't know what happened. Okay, every once in a while it acts up. So, over 40 million Americans travel internationally. That's a lot of people that travel. And people are no longer just going to Mexico or just going to vacation spots. There are a lot of people that do mission work, humanitarian work, as well as volunteer tourism. So there's a lot that you need to know. But don't be alarmed because I'm going to show you resources that'll help you a lot. First of all, with their pre-travel prep and patient education, it's not always covered by insurance, so you have to watch how you bill and code. You want to encourage your patients to carry traveler's insurance, that in case there's a problem like an illness or an emergency, that they would be able to be evacuated or at least taken care of during that time without having to worry about it. Excuse me. I know traveler's insurance is anywhere from $20 to $120, which is totally worth it. You also want to encourage travelers to carry a written list of their current medications, their allergies, their emergency contact. I recommend that they carry that with their passport in case they need it. The other thing I recommend, if they're taking their phone, they should also take a picture of that piece of paper for their phone and also a picture of their passport in case they would lose their passport. So what are some of the risks of travel? Well, as always, there are some tropical infectious diseases. There are waterborne diseases. There are heat and weather related illnesses. There's injuries. There's crime. Of course, there's crime anywhere. And there's also the risk of getting a DVT due to the length of travel. I know when I travel to India, it's usually 14 hours, and that's just one flight on one airline. You don't get to stop anywhere. When I travel to Kenya and Tanzania, it's usually 8 hours and 8 hours. When I travel to Nicaragua, it's usually about like 4 hours and then another 3 hours. So I usually have to stop somewhere. So you want to make sure that you assess the patient's risk of getting a DVT depending on their history. So what do travelers really need as far as medications and immunizations? We're going to visit the CDC website, and you guys will be able to get on to this website yourself when you are a provider. I used to use it all the time. And it'll tell you a lot of things about whether or not they need water purifiers, what types of medicines they need, what immunizations they recommend. So you don't have to worry about that, which is kind of nice. So let's go to the website. Okay, so here we are at the CDC website, and you're probably going to want to put this on, bookmark it as a favorite. Otherwise, I always remember cdc.gov. So you're going to look where it says Travelers Health. If you see this, you're going to, can you guys see what I'm putting on there? Okay, so where it says Travelers Health, you're going to just click on Destinations. And then this part for travelers, you can either tell your patient to look at that, or you can also print something up for them too. But as you can see, there's boxes that you can push down here that will kind of help you even more. So let's go over to clinicians, and let's say we're going to go to, where do we want to go? Afghanistan, okay? And then we're going to have an extended stay, and we're going to do mission disaster relief, okay? So now we're going to hit go. So first of all, it shows you a nice little map, which is kind of nice. And then it's going to tell you what you need. So the recommendations, so these are routine vaccinations that you would be recommending to your patients. Hepatitis A, which you almost always need when you travel, because hepatitis A is foodborne. And if you're eating out, which you will be, excuse me, if you're eating out, you definitely don't want to get hepatitis A. Most healthcare workers already have hepatitis B, but if your patient's not a healthcare worker, they might not have that. It depends where you're going to go if you need malaria. So you see this little thing that says malaria risk areas. So you can ask your patient where exactly they're going in Afghanistan. And it should pop up, a map should pop up. Well, that didn't work. Let's see. Let's go back. Maybe it's just everywhere, because some places it'll have a map and it'll say you just need it in this region, but not in this region. So then malaria, polio. So you want to make sure if it's an older person or somebody whose mother didn't believe in vaccinating them, that they have had polio. If not, you can definitely give them what I call a booster. An adult can get that. Rabies, you don't need the rabies vaccine unless you're going to be working with animals. So if you're going to be working with farmers, if you're going to be working with wildlife, then you would need the rabies most likely vaccine. Typhoid is waterborne, so I recommend that to most third world countries. You definitely don't want to get typhoid. You can get a typhoid shot, which lasts 3 years, or you can get the oral pills of typhoid, which lasts 5 years. So I usually recommend that you get the oral. And then yellow fever. So the yellow fever vaccine is not cheap. It's about $150. You used to have to go to the travel clinic to get it because only a few people are certified. But at least here in Wisconsin, as a primary care provider, you can write a script for it and they can take it to Walgreens. I know for sure Walgreens has it. And Walgreens, the pharmacist there will give it to the patient, which saves them a lot of money for the travel clinic. Okay, so here are some non-vaccine preventable diseases that they want you to be aware of. One is dengue fever. I'm sorry, nobody wants dengue fever. Let me tell you, it's awful. I know that sometimes they have it in Nicaragua. It goes through, I don't want to say epidemics, but it's like certain times of the year, dengue fever is more common. It does cause neurological problems. Many people fully recover, but some people don't. So you definitely don't want to get dengue fever. It's carried by mosquitoes. What's nice is it tells you all about it, about the disease. And it's even got stuff you can print up for the patients. If you go to patient education, you can print this up if you really want to, and it just kind of tells them what they need to be aware of. So then we can go to airborne and droplets. So of course, tuberculosis, so you want them to be careful, especially if they're going to be working with sick people. And then there's always the avian influenza, the avian flu. So then here you see the next part of the screen says patient counseling. So you don't have to memorize all this stuff. This is stuff that you can get as a resource. However, on the exam, the next exam, there might be a couple questions that are basic questions like, why would somebody need a hepatitis A vaccine if they're traveling overseas or something like that. So eat and drink safely. So it'll show you if you want to know anything about that. And it tells you counsel travelers to be diligent about food and water precautions. Avoid cooked food served at room temperature. Avoid raw food, including raw vegetables, unless they can be washed thoroughly. Drink only beverages from sealed bottles or cans. Water is safe if it has been boiled or chemically treated. And notice this one, which people don't think about. Avoid ice unless it's made from bottled or disinfected water. So I travel a lot, and so when I travel, I don't get any ice in my drinks ever. And I never take any drinks in a glass. So if they have soda or if they have water, I ask them to bring it to me in the bottle and to leave the lid on it and open it at the table. I just like to be sure. Okay, and then it tells you here, if you look at how to prevent bug bites, it tells you how to do that. It tells you all the different types of things you can use, including oil of lemon eucalyptus. I think people will smell you coming, but it might be worth it. And then how to stay safe outdoors. It's just got a whole bunch of stuff here. Know how to get medical care. And you can tell the patient if you don't want to print this all up, which you might not want to, you can just tell them how to get on this website. And like I said, they can look it up themselves. So this part, the next part says healthy travel packing list. So if you click on that, it's for Afghanistan. It'll tell you what you should be bringing. I tell my patients I print this up before they come, and then we go through this. So they need to make sure they have enough of their prescriptions to last them while they're there. They usually need a traveler's diarrhea antibiotic, which is Cipro 500 milligrams. As far as a suture syringe kit, I don't know. That would be interesting. I guess if you're going really into the wild or doing something wilderness and there will be absolutely no chance of you getting medical care, maybe you can suture yourself. And your medicine to prevent malaria, and then altitude sickness if you're going to be going up into the mountains in Afghanistan. Other medical supplies would be glasses. I usually bring 2 pair. Bring a couple pair of contact lenses as well as the solution. And of course, if you're diabetic, needles or syringes. Insulin, all this stuff if you really need it. Inhalers. I personally have an EpiPen that I bring with me. And then if you do have a severe medical problem, make sure that you have a medical alert bracelet or necklace, or you can put something in your passport, like a little piece of paper. And then over-the-counter medicines, I highly recommend you bring antacids like Tums, because sometimes the food is a little spicy or your body's not sure what to do with it. I also bring Pepto. If you think you're going to need motion sickness medicine, some of the places that you travel might have like really bumpy roads, and you do a lot of swerving, and some people get really sick in the car. Antihistamines for bug bites. Cough drops if it's really dry there, I suppose in Afghanistan. I usually bring Dayquil and NyQuil just in case. And then always bring Tylenol and Motrin. And you don't need to pack a whole suitcase full of this, you guys, just a small little bag. As far as a mild laxative, it depends where you're going. If you're going someplace you're going to be eating a lot of like bananas and rice and you might not go to the bathroom, then you might need that. As far as a mild sedative, because you might not be able to sleep, you can just use the Benadryl, which is above under antihistamines. And then the saline nose spray, it just depends. Some people get very sensitive to the air when they travel. And then I always bring hand sanitizers. As far as water purification tablets, it just depends where you're going. There's something called a life straw, and it's really easy. It's a huge straw that has a filter or a purifier in it, and you can drink water from anything. You might want to bring a mosquito net, or if you're going to be staying at a hotel, ask them if they have those in the room. Sunscreen, of course. Definitely a sunglass and hat. That sun is very hot in some of those countries. Earplugs if you want. I know we bring earplugs to Nicaragua because there's a lot of fruit that drops on the tin roofs and wake you up at night. So, and the dogs bark early in the morning to late at night, and then the rooster gets up early. So I always bring earplugs. As far as condoms, that's totally up to you. And then here's a little bit about your first aid kit and some documents that you should be bringing. So I think this is really nice that you're not floundering trying to figure out what to do. If there were some travel health notices, it would be in this section right here. This says travel health notices. And then here's advice for returning travelers. So what happens is sometimes people aren't sick while they're there, but they might get sick months later, weeks later, even years later. So you need to make sure that if you do get sick, you let your doctor know, your primary care provider know that you have traveled. So one of the things, malaria, people, you have to take medicine to prevent malaria, but it doesn't really stop you from getting malaria. What it does is it kills the malaria as you get it, which is why you need to continue taking it when you get home. So sometimes people get home and they're like, oh, I don't need to take the medicine anymore because there's no malaria here. Well, you could be in a certain stage of malaria inside your body, and then it becomes full-blown malaria. And personally, I've had malaria, and I honestly tell you, you do not want to ever have malaria. Okay, so I hope that helps you. So let's go back. And you remember the cdc.gov, and then remember you go under travelers, okay? So let's get back to our PowerPoint. So I hope that kind of helps you guys figure out a little bit about travelers' health. You need to read your book. There's information in your book about some of the different diseases. It's very important that you read that. If any of you are planning on going on a global trip, or if you're planning on taking care of people that are immigrants or people that are refugees, you definitely need to know this information. There's also certification that you can get. I was trying to kind of look into a little bit to see what it is, but let me just show you. This is the website. Yes, it's safe. My computer's acting up. Okay, so for $199, you can get this web-based training, and you can get CMEs. And we all need CMEs, especially after we graduate. So if you're interested in that, you might want to think about it. These are the different modules over here: epidemiology, traveler's diarrhea, immunization review, diseases spread by environmental contact. So it might be, if it's something you're really interested in, or you're really interested in doing a lot of mission work or something, you might want to think about. So that is it. If you guys have any questions, please feel free to email me or post those questions. This week you do need to watch the video on hunting the deadly bacteria, and that's going to be part of our discussion this week. You all need to watch it. It's very interesting. And have a good evening.